All this is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. So, how is everything? How did you like the Fluvoxamine study and how did you like the efficacy study? How is everyone? So, Rima, I caught your comment saying I was a Speedy Gonzalez. I hope I was able to present as well. Um, so, Morehouse, you had asked a question, what is RBD? Receptor binding domain. So, if I very quickly share this screen, and if I go to if you see the spike protein here, on the spike protein, there is a part of the spike protein that is used by the virus, or that is a part of the spike that docks with ACE2, right? So this part that docks here with ACE2, this part is called receptor binding domain, or RBD. So of course, any antibody against the RBD is going to be a very effective antibody because it would block the docking of the virus. So that is what RBD is. Roman, how are you doing? So Roman is here. Moorhouse says, I'm getting impatient with the lack of standardized measurements of antibodies. It's about time we had these. There are standard measurements for other vaccines against viruses. So let's say for our reason, we can, this is why exactly I actually showed this number. If I go down here, this number, they used it as someone who was previously infected and had COVID. Now, is this number sufficient to say that somebody who has this level of antibodies that would give them protection? That is not known. It is an indicator that the presence of antibodies are above the threshold level. They're above doubt that they're there. It's not a fluke. It's not a failure of the test. They have to be there to produce this number. But are they sufficient? It's not the antibodies that are sufficient, it's the immune system. So it's really the immune system that has to be. Do you know how I usually see it? If somebody has this number and they were either symptomatically or asymptomatically become sick and recovered, then they recovered, their immune system is able to recover. But you are correct, these standard numbers are not out there yet. Christine says, isn't this a chocolate day today? Okay, give me a good question. April says, what is the best antibody test to take to see if I had a suspected COVID infection 8 months ago? So I would suggest both the tests. And again, not a medical advice for anyone at all. This is just general informational discussions and mechanism discussions. T-Detect is an approved FDA test, which would look at memory T and B cells, especially T cells, as it says, and then the antibody test as well. Antibody test should figure out after 8 months, there should still be antibody titers, maybe lower level, just like I was showing here on this screen. And then T-Detect would look at the T cells. If I am the one who is getting them, I would get both. Colin Hamill, how are you? Hemi. Okay, so Modema Rose says it is very strange. What is strange? Roman says, I hope you're doing well. Medical lecture, your sweater remains us all that fall is here in winter. So I'm going to tell you something. Do you see that let me change the screen for a second. You may notice I'm looking really red today. That is because it's hot and I'm still wearing this sweater. And my wife was saying, why are you wearing this sweater in this warm temperature? I was just wanted to wear it. So I'm blushing because of the warmth. Rima says your wife will burn the sweater. Well, she actually found a better solution. She said, I'm going to buy you a couple of more sweaters so you can leave this one alone. Okay, so let's see. Zunar says, could J&J be activating other areas of the immune system that's maybe not well understood or maybe isn't the focus of the mainstream studies? No, so look, J&J is also a vaccine that produces spike protein. So ideally, they're still working with the spike protein, I think. And I really hesitate to say this, and I'll tell you why. I think it is their adjuvants that may not be as powerful. But at the same time, why I hesitate to say this is my wife had J&J and she had side effects for 8 months. So whatever was in there was powerful enough to continue to cause side effects for a long time. Her doctor still says that this is the side effect and that is the side effect. So I would not want them to make it more powerful, but at the same time, it didn't come up to as close to messenger RNA vaccines as it could. So Sagun says, are boosters safe to take now for 65 and older and won't have side effects such as myocarditis, etc.? So look, there is no guarantee, correct? The booster data that they showed, Pfizer's booster um, study results that they presented to FDA to get the booster approved, they said there were no additional side effects of concern. So I would suspect, I haven't seen, remember, this is a medicine by press release. I haven't seen the actual data, so I cannot actually see what did they see or not. But if we take them on their words, that means whatever was the chances of side effects before is the chances here as well. Now, here's a good news. I started this series for this reason. So I'm going to actually talk about 60 plus age as well and talk about which vaccine has how much efficacy and what kind of side effects were seen and compare them. So we'll keep comparing in the coming days. Okay, so give me a good question. Frisco coupon after a long time. So at this point, is there a better option for anyone choosing to have a third dose 6 months after second Pfizer dose when comparing Pfizer versus Moderna? So if, look, I have Moderna already. I loved Novavax first, then Moderna, then others. So if somebody gives me a choice now, I'll go for Moderna. And here is a problem. I like Moderna, but many people do not like messenger RNA vaccines, saying these are newer kind of vaccines. These are still prototype projects. They still need to be tested. They still need to be known for their long-term efficacy. That is where I cannot promise anything. I can tell you for myself, if somebody says today you got to go get a booster, I would like to have it for Moderna. And somehow, I do not know why, but Pfizer's vaccine efficacy reduction keeps coming up in the documents. Although Pfizer is strong enough of a company that everywhere they continue to replace Moderna and get themselves in. So 2KA says full or half dosage of Moderna as a booster after 2 doses of Pfizer. My wife works in a hospital that suffered from a cluster lately. Thanks. So from the FDA's document that I discussed a few days ago, here is how the structure is. If Moderna is given after Moderna, for example, I had 2 doses of Moderna, after 6 months, if I am given a booster, then that will be a full dose of Moderna. If Moderna is given after Johnson & Johnson or Pfizer, then it is given after 6 months of Pfizer and half dose. It is given after 2 months of Johnson & Johnson, half dose. So that is how Moderna is. Pfizer given in full dose after its own series or Moderna or Johnson. Johnson & Johnson given in one dose after its own series 2 months or others. Jana is here. Hey Jana, how are you? WBC continues to drop. Just finished day 3 antibiotics for respiratory infection. Oh, I'm so sorry. Did they tell you why the WBCs are dropping? So Banzobin says, does anyone know if Novavax or will be soon available in Mexico? So of course that trial that we discussed was in US and Mexico. So ideally Mexico was participant in the trial, so they should be able to approve it. I do not know. I'm sure that somebody else knows. We should look at Novavax's site as well. Gift24 says, how many paws does Luffy have? So Luffy has 4 paws. Okay, so Sagun, you're very welcome. Okay, question. So let's see. Cubert's Corner says, Dr. B, what are your thoughts on the natural immune receiving 2 doses of the vaccine? Should we be concerned with the T cell exhaustion? One study showed a deletion of T cells after number 2 thoughts. So first I have to see the study because I find it difficult for a study to show in a normal healthy person a depletion of T cells after vaccination. That should not happen. And there is a reason for that. Let me, I'll draw this. So let me go back to your question first. What are your thoughts on the natural immune receiving, a person who is naturally immune or had infection and then receiving 2 doses of the vaccine? This is really a decision between them and their doctor. But as you've seen, that various countries have said either 90 days after the infection or 6 months after the infection, or in the US, I think a smaller time period after the infection, one can get both doses. Even 1 dose will be actually good enough to boost the system, but it also depends upon the person's body, their immune system status, their comorbidities, and other things. There may be actually, even after the booster, there may not be sufficient immune response. Now, having said that, I want to go to the second part of your question as well, that will T cells be depleted? So let's talk about that. So let's see here. What happens is, let's say natural infection. When the natural infection occurs, this is the innate arm, correct? Innate arm. Innate arm, macrophages, dendritic cells, those cells will receive the virus, they will detect it, they'll pick it up, phagocytose it, break it down into smaller pieces, present it onto the surface. We know that. Then there will be naive T cells, and those T cells would then go both routes, T helper 2 route, T helper 1 route, and then they'll go B cell to plasma cell, and here T cell becoming active T cell, correct? CD8 positive. And plasma cells here. I'm just making a quick diagram. Now, there is no mechanism, vaccine or infection, that would cause the depletion of these cells. So, for example, let's say now this is done and the person has these active cells and or memory cells, right? So they have these memory cells and they get re-exposed, let's say through a vaccine. So when they get re-exposed, what would happen is ideally the memory cells that are present, so if I make them here, memory cells that are present, these memory cells would start proliferating, increasing in number. So in theory, in a normal healthy person, when the antigen is exposed again to the body, our immune system would actually increase the cells in number, not reduce it. And there is no mechanism within the immune system to reduce the cell unless we start attacking our own cells, which does not happen in this case. So I would like to see that study to actually understand more that what is the mechanism they're saying. Doug says innator. Yes. Did I say innator? Yes, I said innator. Thank you. Okay, fine. I will remove it. Innate arm. All right. What else? Mrs. Caruthers says, with the fluvoxamine study, is it a strong enough study I can take to my doctor here in Toronto, Canada to use as early treatment should I need it? Yes, it is strong. The 32% risk reduction is a significant risk reduction. The size is good as well. It is randomized control trial as well. And it is done on the severely not severely ill, but outpatient adults as well. So everything is good with this one. There still are doctors who are saying, well, we need more trials. I wish we say the same thing with those tiny little trials which are getting other drugs approved. For example, look, remdesivir actually has shown to be not efficacious. That is not getting off the list. Sasha, in the last talk, early part, I talked about that study. And I'll do a deeper dive later on as well, tomorrow. So SK has a very good question. Can a lymph node be permanently damaged from swelling? So it depends what kind of a swelling lymph node has. So let's answer that question. Good question. I like good questions. So here is, let's say, a lymph node. Correct. Now, swelling of a lymph node, it's not necessarily just physiological. Physiological is that antigen is brought into the lymph node, and that antigen causes the local T and B cells to proliferate and increase in number, and that causes pressure on the lymph node. Not in all cases, but in many cases. And that pressure would then cause the swelling of the lymph node and pain. And in some cases, there can be damage to that because lymph node can become calcified because of all that inflammation. Now, lymph node can become damaged because of inflammation directly, because the cells in the lymph node are infected and they're fighting and they're dying and inflammation is occurring there. That is one possibility. And second possibility is that antigen is coming in there and the cells are proliferating and there are so many cytokines in there, and then all other immune system cells arrive over there as well, and war happens for those inflammations. And then there are other possibilities as well. With those inflammations, it is then possible, as I said yesterday, that calcium loves to get deposited in the areas where there is damage going on. Our body repairs things in interesting ways. Here is how body repairs. Let's say this is a tissue. All of our tissue, for example, our liver, our lymph node, our spleen, our lungs, our tissues have a basic structure to them. And that structure is in the form of something that we say basement membrane. Basement membrane. You know, just like when we make buildings, we make a skeleton of the building and then we put various, things in there to fill those skeletons to make buildings. Similarly, our body is also formed with the skeleton of the tissues. The tissues have soft skeleton. That skeleton is called a basement membrane. If basement membrane is intact, then even if the cells that are stuck on top of it, even if they die, they can be replaced on them and the tissue can become recovered and normal again. But if during the inflammation, the basement membrane itself gets damaged, the skeleton gets damaged, then our body has no idea how to repair this part. Imagine if a building skeleton or the framework is destroyed and you send in builders to say, just go build the same building again on this whatever is destroyed skeleton. They can't build the same building again. So if the skeleton is destroyed, then the tissue may even be regenerated, but that would be just haphazard cells. And if the tissue cells are not arranged correctly, they cannot function correctly. For example, in liver, they have to be arranged in little slices where they can function. In the lungs, they have to be arranged in a very thin membrane where they can do a gas exchange and so on. So all tissues are arranged in structures. If the structure fundamental is destroyed, then the tissue cannot function again. So what body does is it starts depositing calcium in those areas. It kind of puts cement and destroys that area, says it's gone. And now I'm just going to fill it up. So it puts calcium there, it can put proteins there, and scar formation can occur. If that happens, this lymph node, if this happens inside the lymph node, this lymph node is now destroyed. It is there, it would be a hard nodule-like thing because it is filled with calcium now, but it would not be functional. So to answer your question, can a lymph node be permanently damaged? Yes, some people get inflammation. I actually have a lymph node here that is just gotten from my childhood. it has become, I used to get so much sore throat again and again that finally some of my lymph nodes just became calcified. So yes, they can be destroyed. Good question. Give me 1 second. I'm going to let Luffy come back in. 1 second, please. Okay, so I have closed the door for Luffy. He cannot go out anymore. So get ready for listening to his songs of his people. Okay, Luffy break. Yes, he just came back. All right, so let's see. Janelle says, what do you know about Wilbrand factor and the COVID-19 vaccine? I don't know. Give me more context or give me a question. Let's see. What constitutes a lymphoma? Lymphoma is basically a cancer or a tumor of the lymph cells, which are T cell, B cell. So there are multiple kinds of lymphomas, and basically a cancer of the lymph cells, B cells, T cells. And there are many kinds of lymphomas, and it's a vast field. Maybe we should, I was thinking of doing this, and maybe Cool Beans, you can comment on it. Hypertension, diabetes, we're doing a series of diabetes with Dr. J.S. Sanghni. Do you think we should do a series, I will do it, about how our cells protect ourselves from developing cancers? How do cancers develop? How those mechanisms for protection are bypassed? And how cancers are then our body tries to handle them, and how various treatments for the cancers work. Okay, so give me a question. Easy Bean, thank you very much. Dubachi, you would listen to his songs. He came in, went for his food. Now after eating food, he's gonna come and start singing. There he is. Luffy. No, you're not going out. Not out. Not out anymore. So the song of his people has started. Okay. So Margaret says yes about cancers. So, okay, cancer is a very interesting and important topic. So if you like, I can do this. Hey, Luffy, come here. No, you're not going out. Don't be loud with me. Rima says he's got girlfriends waiting. He just goes out and fights with others. I can't let him out today. My wife is out and nobody's going to get him back in. So Susan Law says, how far away from infection is IgG and T cell reliable? So again, as you saw, IgG above a threshold level, any time away from the infection, 6 months, 1 year, 2 year, is reliable. We won't develop IgG against a spike protein if we didn't have the infection and if our cells are not making it. Now the T cell, also the same thing. The only thing is what I do not know. How far, so Luffy and I are going to take turns. How far long T cells continue to be available in the bloodstream? What, Luffy? No, you're not getting coffee. You're not getting coffee, Luffy. Okay. Mball has an interesting question. My brother had a stroke, sorry about that, aneurysm, and ended up with not only a brain tumor or tumor on his lung as well. This was about a week after his second Pfizer dose. Could this have been from vax? In general, a vaccine cannot create a tumor so fast and in so many places. So at least I have not heard of that. Gazar says all the mice have ran off in my room. Now Luffy wants to go out. He's now pawing at the door. I'm not gonna let him go out now. Zan Solo says, is there something about the working of our natural immune system that vaccines are not able to imitate or not imitate perfectly? I hold the notion that natural immunity is the best. Okay, so natural immunity has a lot of benefit. And I discussed this morning. So this is my actually third talk today. There was a talk in the morning at 9:30 with Alison Morrow. She's on Odyssey. If you get a chance, please check her out, her videos. She recently recorded a video saying that I got fired for talking about COVID. So I had this discussion this morning with her as well. Look, natural immunity is better actually, but it is very risky. Trying to say I would get naturally infected, that is very, very risky. So I would not want that for myself. I would not want that for you. So whatever is your way of protecting yourself, you should do that. But if somebody has infected, for example, in the US, 45 million people got infected, recovered, 750,000 and 60,000 ish, unfortunately, they died. The ones that have recovered, they have good immunity. Frankentronic says, I like your sweater. Thank you very much. As you can tell, I am in love with this sweater, even at the risk of too much warmth. Now Luffy is gone from here because I didn't open the door. He's now trying to find where my wife is. So she would come and listen to him and open the door, but she's not here. So nobody's going to open the door. Luffy's a fun cat. Okay, so question. Christoph Petrosis says, I'm so sorry for mispronouncing it. Could chronic eye burning, dry eyes, eyes pain be a symptom of long COVID? Yes, it can be. It can be. So a true seeker says they keep pushing vax, which to me seems wrong. Yeah. Luffy, what happened? You did not find her? I'm not going to open the door, Luffy. Skyfrog says, considering the calcium buildup during infection, especially in the alveoli, should calcium intake be reduced? No more cheese? Actually, no. So our body is so sharp for calcium like things or the things it needs for repair. It doesn't care what you bring from outside or not. If it needs calcium, it's going to go and mobilize the calcium from the bones. And how it works is very interesting. So short answer, no. And long answer is this. Here is what happens. And this is a more less medicos answer. For medicos, I'm going to say this. We know as medicos that the calcium level and phosphate level are together maintained. Correct? We know that. So there is a product of this, calcium multiplied with phosphate. That number is maintained in a homeostasis in our body. So that is from medicos, they would understand it. Now for us, the rest of us, what happens is, let's say here is a tissue. This tissue picked up some calcium and used it up. Calcification occurred. Maybe there was a damage here and body is filling that damage with the calcium. The dead cells are filled with calcium. This is like our body's way of embalming the dead tissues. So calcium is being taken. So when the calcium is taken, what body does is it says, okay, so what is the calcium level in the blood, in the tissue fluids? Now, based on that level, body would try to take more calcium from GIT. If it cannot get it, so let's first see the normal mechanism. Try to take more or absorb more from GIT. Also try to reabsorb from kidney. So kidneys are said that, hey guys, don't throw calcium out, we need it. So kidneys say, fine, this calcium was here to be thrown out, we're going to cancel its visa and throw it back in. So reabsorption, so stopping the calcium from getting out. And then the third factor is the bone itself. If the calcium cannot be found from the GIT or cannot be reabsorbed from the cell in the enough, from the kidney in the enough quantity, then a message will be sent to the bone to say, give me calcium. And bone is filled with calcium. Bone would say, okay, fine, I'll give you calcium. And you know that calcium can be mobilized from the bone to a point where bones just become rubbery, right? There are conditions in impoverished areas in children where the bones just do not have enough calcium, and they're just all bendy and rubbery. So that means if you don't take calcium and body is using calcium somewhere, body is not going to care that you're taking calcium or not. It's just going to either get more from the GIT. If you're not giving it calcium, it's going to try to reabsorb from the kidney and not throw more out. If that doesn't work as well, it's just going to get it out of the bones. And so not recommended not to take calcium, because then it's going to cause the bones to become weak. This is a normal mechanism. So if I go to the crux of your question to say, how do we prevent this from happening? It is controlling the inflammation. That is the answer. Control the damage. And that is give anti-inflammatory, treat the basic cause that is causing inflammation, treat the disease that is causing all of this. So that is how to manage. Good question. Thank you very much for this super chat. This is a good question. Hazard says, can ivermectin affect cortisol levels? So ivermectin has no mechanism that can affect either hypothalamic function or pituitary function or suprarenal gland function or any conversion in the other cells. So no, ideally, in theory, from a mechanism point of view, ivermectin cannot change cortisol function levels. Did you, Anna, you caught that? So Luffy is actually very communicative. So he can actually listen to what we are saying and then change his tone accordingly. So see, now he's become disappointed that door is not going to open. So he has gone, is now going to go eat something and sleep somewhere and maybe curse curse me as well. Maybe he's going to go and launch some complaints to. Here he is. He said, yes, I'm going to do it. Luffy, door is not opening. See? Okay, so Rima says, for Dolly Betty's question regarding tinnitus, what is thought to work, not specific advice, also for eye pain, aspirin, and such? So, very, very interesting question. And the answer is going to be not full because I still haven't seen any medicine that has been working for COVID related tinnitus 100% reliably. First thing that I have seen with my patients, if tinnitus occurs, normally reducing the inflammation helps. So that means there is some inflammation going on in the brain area, and that is then causing compression of the nerve or irritation of the nerve or the hair cell or something which causes tinnitus. So reducing inflammation helps. That's one. Now you can reduce inflammation. Again, I know that you are a healthcare worker. So this is not a advice for anyone. This is just a discussion of mechanisms. One can use low dose steroids. One can use other anti-inflammatories. There are many kinds of anti-inflammatories. And of course, ivermectins and fluvoxamine are one as well. My apologies. He would keep becoming loud because he wants the door open. I cannot open that door. So please bear with me. His songs are getting louder. You knew that he was listening to me. Luffy, why are you doing this? If I spoke, he's gonna start talking again. Okay, so steroids, anti-inflammatory. In those anti-inflammatory, what I've seen a lot is ivermectin plus fluvoxamine has been working. Then I've seen naltrexone again work for tinnitus as well. Not me, I haven't directly used it, but I've seen patients who their doctors used naltrexone and they became so tremendously well, and the tinnitus went away. So why did that happen? I'm going to talk about the naltrexone's mechanism of action in the coming days, but exactly how did it happen and help tinnitus, I do not know. But these are the things so far. And I have also seen tinnitus reducing when people do the lymphatic massages. That I think kind of circulates the lymph a little more, or maybe reduces the pressure by lymph flow, and that helps. Frisco Coupon says, five pretend dollars. Says Luffy's thinking, I will win, the door will open. Yes, but what he doesn't know is today that because my wife is not here, I can't open the door because nobody's going to go and get him back in. Hey, Luffy, what happened? What? Tell me. He was here. Ozette says, my dog here's Luffy and is looking for her. Him. Luffy is a him. Luffy? Man, don't do it. Zan Solo says, Luffy is protesting against the lockdown. That is correct. Yeah, so Eric, this is correct that there is some tinnitus that is just not going to be fixed, and that would be forever. David says, my father-in-law told me that they had to halt the trial on Angenic. Can you confirm this? I thought that they stopped the Angenic trial because Angenic trial halted. So I'll have to do some research to see. I saw one trial terminated, but that doesn't seem like COVID trial. That seems like just general. Um, so I'll have to look into this one. Good question. Farida Sultana says, can you please answer my question? I'm not vaccinated at all. 69 years old, mostly homebound, have ivermectin on hand. Tell me about my risk. Do have diabetes and so, Farida, I have said it many times. I cannot. It is unprofessional, unethical for me to actually give advice like this. Um, I can do that for my own patient, but not for anyone. And even for my own patient, I cannot do this kind of advice, which is so personal and so targeted. So I can usually discuss things in general mechanisms, but I cannot. This is like practicing medicine. So that's what I should not do. Nobody should do. Even if somebody is licensed to work here in the US, they should not just get on the net and start practicing medicine and giving advice without a patient doctor relationship. So, my apologies. I really, really feel bad, but I can't answer this question. Teresa Stewart says, interesting note, after COVID, my tinnitus, ES bad, was doxycycline taken and worse hearing loss. My ENT did MRA and MRV of brain and showed moderately narrowing of sinus on left side after COVID. So did that then go away? Gina says, I saw a video you did on Nigella sativa. I read Nigella inhibits the release of histamine from mast cells. How interesting in light of Dr. Chetty's success treating with antihistamines. Yeah, so antihistamines have been a long known aspect that they are part of COVID symptoms and becoming aggravated. So this has always been the case. So, okay, good to know. So C-Rogue says, C-Rogue, have there been any studies on the impact of diet on COVID? No, but there have been studies about microbiome, and I have to discuss some of those. I think there is, so sometimes I think about this, that those folks who deliberately tried to derail and distract me, one disservice they did was to reduce the volume of knowledge that could be shared. And that is for them to live with. But I was going to say that there is a lot to be shared and so less time. And I keep trying to do my best. I still haven't figured out a way to curate what should be the next topic in a more reliable way and then work on it. So maybe uh, Patreon is the place. The reason I just don't use Patreon is I don't want folks to feel that they have to pay to be able to get to a topic. I want to be, I think of Patreon as folks who are supporting this work. I think of, for example, Margaret, who is working, she has always been very generously supporting this work to be able to bring whatever topics are needed by the public instead of what they need. But I still haven't figured out a good mechanism to curate the topics. Rita says, thank you for all your info. I found Dr. Corey and FLCCC from you. Use the protocol and I've nothing from doc list that provided. I did great without vaccines. Good to know. These are all his ways of saying, open this door, I want to go out. Russell says, I work in a high school in the US. One of my favorite students has myocarditis post vaccination. He's 16 years old. I can't trust these vaccines. I've seen so much damage. How is he doing? So Nipa says, please call Dr. Sabine Hazel. I actually talked with her on Twitter, and I requested her if she would like to be, if she would join us. She said she discussed a couple of things, but she did not agree to. I asked her a couple of times, and it seemed like I'm pushing, and she's not agreeing, so I did not ask her further. Janet says, we're very grateful for Margaret. Yes, me too. Margaret has been really helpful. Yeah, tinnitus is... so it is interesting that I had tinnitus from a very young age, but I actually thought that was normal. So I used to ask people that, hey, do you hear a sound in your ear? And they would say, what sound? And I would say, this, this something like a, drill machine. Do you hear that sound? And they would say, no, we don't. And I used to be surprised that they don't hear the sound. But by the time I have become so used to it that I don't even know. I have to really, really think about it for it to bother me. But in the beginning, I used to actually think it is normal. Margaret says, I was trying to agree with you about acetaminophen and tinnitus. Yeah, tinnitus is tough. Ganesh says, just posted a question that what does he want with his muse? So now Kyrie is down here as well. She's here. Luffy has gone there to start eating. He's going to come back to sing more songs. He's going to keep trying till I finish this talk and then go and be with him and tell him that stop is not going out, and then he would be okay. Russell says, what kind of a cat is Luffy? So Luffy's a Bengal. Frida says, thank you very you're very welcome. I'm very sorry. I wish things were different, at least for pandemic, that people could help more openly. But there are lots of uh, structures. Colin says, why put a thumbs down? Why less than 100 likes also? I get thumbs down even before the talk starts. But um, we I get a lots of love as well. Uh, I can tell you this, Hemi, I never actually thought that I'll come in and I'll talk and we'll become this friends community and we'll be together for so many months. So I'm very, very grateful. Anna says, I had tinnitus since I was in high school for about 60 years now. Yeah. I was very young when I had tinnitus. I think 7, 8 years old. And I always thought it is normal. So I never even thought about it. And now, sometimes, very rarely, if I'm sleeping and I am just in total silence and I can hear it and then I just wish it away, I just want it to go away. But it is really, as you can see, it doesn't really bother me at all. I don't even now when I'm talking, I don't hear it. Farida says, pick Luffy up and let us see. Okay, he would actually be fine getting picked up because he would think he would be going out. So let me find him. Luffy, Luffy, Luffy. Is totally upset and agitated and wants to go out. He's gonna start his song again. So Michael says studies for neuro side effects. I couldn't find them on Discord. I remember at one point John Snyder had put them. Today, Texas shared a study. So I think we'll talk more about that in a few days. So already, Texas is already kind of taken a thread out of my sweater. I'm not gonna tell my wife it happened. Robin says, I bet Luffy stripe t-shirts. Yes. Did you see that the IVM, the Luffy Mectin, these t-shirts were just removed without even telling me. They were just gone. Luffy, stop. Russell says my tinnitus changes sounds. So sorry about that. I feel it's a difficult thing. Water violet of Dr. Bach helps for tinnitus. Very interesting. So Robin says 35 plus waiting. So for the, again, not a personal advice, for the distance between the shots, UK said 84 days, and they were successful with it. Otherwise, usually the shots are given with the proper structure, 4 weeks or 3 weeks. Every primary series has its structure. But UK said you could wait for 84 days. And it was interesting that they showed from the UK studies that the immunity or antibodies kept improving and went up to 80s. And then giving the second shot actually pushed them into 90s, but they were still in 80s. Frankentronic says, Dr. Bean, do you play any instruments? I like your artwork. So thank you very much for liking the artwork. I love playing sitar. So when I was in Pakistan, younger, I used to have a teacher who would come to our home and teach us sitar. And I used to learn that every day for 3 years. And then we came here, and then it became difficult to continue. But I love sitar, and I've been playing sitar for a long time. Hubert says, how do we get in touch to share a study? Best is to either tweet it at me or for Discord. Rima says, I want a brain out shirt. Okay, so let's see. I'm going to show brain out again to folks here. Let me first get that open. So here is the brain out shirt that Rima is talking about. So I was just doodling yesterday. Luffy, I will draw you. So Robin says yes, but what about returning to heavy workouts after the shots? The again within 3-4 days, after a week, I think after the first shot there may be some fatigue and those for a few days, weeks. But if I was the one, I will give it a month or so. Janet said, I wonder if Dr. Bean has set his sleep number bed on fire yet. No, not yet. Rima says, I love that character. Yeah, so I thought it was funny, this character. I was actually drawing it for Halloween, to actually share with the cool beans here, to say Halloween, and you just keep studying all the time for medicine, or in my case, studying the studies all the time. And so the brain is just like, I'm done. So Jody says, when are you moving to Odyssey? So, Jody, Odyssey scares me. And here is the scare there. The scare is they have sent me a couple of times, here is this number of steps to do to move. And I think what is missing there is that with YouTube, we do a pre-show half an hour where we just go online and it just notifies people. There is no pre-show of that sort there. Over there, I can go online And I believe this is what my understanding is, they would start recording. And so if I come back online in half an hour, there will be that initial half hour that will be just there empty. And if I want to remove it, I should download the video, edit that, and then re-upload it. So that whole mechanism looks um, not the most appealing. That is why I have not tried it. And every morning I think, you know what, today at 1 o'clock when nobody knows, I'll go online on Odyssey and see what happens. And I just get so busy with the business things and preparations. So that is a long-winded answer to say I want to go online every day, and then I hesitate. So maybe with this push, I'll do it tomorrow. Do a portrait of Luffy. I can do a cartoon of Luffy. I'm not that good an artist to be able to do a good portrait. So can we still get a Luffy shirt? Yes, we can. It is so weird that Spring actually removed all I or Luffy Mectin related things. So, channels like YouTube would tell you, somebody complained, we removed your video, don't do it again. They did not even tell me, they just removed it. Done. Okay, so Anna says, Moose Lodge, good question. So let's see, what is the question? Luffy, look, Moose Lodge has a question. We should answer that together. Yes, come here. So if someone has COVID and is recovering, how long do you think they should wait before they fly in an airplane? So it depends. What are we thinking about? Are we thinking about um, not flying so that we are not shedding, and so the risk of shedding, or not flying for some other reason? If we think that, hey, I may be shedding because I had COVID, then what we have seen is, or the studies have seen, is that after the symptoms are over, within 10-11 days, shedding is finished. However, if you really want to be precise, the WHO's definition of discharge from a hospital, for example, is when 2 consecutive PCR tests come back negative. That is when shedding for sure has stopped, and then person can just do the normal function. But if you are asking that in a different for a different reason, then please elaborate a little more. So Teresa Stewart says, how about Zoom online? How about we do Zoom tomorrow? So let's do Zoom. So Carl Young says, my wife fully vaccinated, laid in bed 3 days and coughed bad 10 days. Sorry about that. So Eric, I have a video titled Stories. In there is a story about me accidentally trying to explore a mechanism and setting fire to my cot. So Teresa says, how do we do Zoom? Do you post link on YouTube? Yes. So if you go to YouTube and go to the community channel, I'll put a link over there. I used to put the link on Twitter, but somehow Zoom has some sort of alerts, and they get that, and then they start sending me emails that, hey, this is not good to put links on Twitter. That can cause hacking and this and that, and skewer it this way and that way. So I don't put it on Twitter anymore, but I put it on YouTube. Texas says infective shedding. I want to see the studies on feces. Seriously, nursing homes have a real problem with this. How long in system? So, Texas, we know that viral debris continues to shed for 59 days after the symptoms are over. Now, during the symptoms or during the active disease, shedding continues, and viable shedding can occur as well. So, that's a very, very good question. So Roman says, please tweet at Sabine Hazan on Twitter. Maybe she will listen and do an interview with Dr. Bean. Yes. So Truth Seeker says, I still laugh when I think about burning beds. Sorry. So I actually have a couple of more stories. I intend to, so see how many things I want to do. I intend to, every morning, I think, you know what, I should put this story together in a visual and share it with you. There are so many stories of me being just silly. Um, Tracy, community tab on Dr. Bean. So let me, Zen Solo and Tracy, let me show you how. Let me go to my channel and I'll share my screen in a second. Let me just go to the channel. Okay, so now I'm at the channel. If I share my screen, so this is Dr. Bean channel, correct? So you can reach this channel by just searching for Dr. Bean. Once you are at the channel, if you see here, there is home, video, playlist, and community. If you click on the community tab, here are the posts that I have. This is the stories post. And then if I have a zoom, this is Luffy sitting on my computer and my paintings. So if I have, for example, look here, let's celebrate this evening on Zoom. So here is the Zoom. So I usually post the Zoom link here. Janet says it was awesome, his stories. Teresa says, beautiful painting. Thank you very much. I love painting. Tracy, you're very welcome. Sasha says, worried about stroke, etc., with inflammation, enough for brain symptoms and attitude change. Okay, so I would say that, again, not a medical advice, not a personal advice, but usually a month later, there is enough. If there is no long COVID developed, you a person is fine enough to be able to have everything in the clear. So John says, why do you think CNN and New York Times had positive reviews on the latest flumoxamine study? I have become too cynical after what they've done to ivermectin. So somebody asked me that, and I said, I don't trust CNN. So what I said was, I said, look, by giving a positive news here, what they just did was they said all of our tussle with Joe Rogan and all of our bad mouthing of ivermectin was justified. If we had seen something good, we would have talked about it, just like we are talking now about fluvoxamine. So I think this is how they have vindicated their disingenuousness that they did before. Teresa Stewart says, you should do a fun painting class on Zoom, maybe fall trees, leaves. Absolutely. I would love to do it. I would love to do it. Tell me this. So if I said that, hey, let's do a painting, I usually use the iPad to do the painting. So should we do that? I would love to. Gift 24 says right on. Thank you. Yeah, they're not doing damage control. This is actually a very disingenuous thing. This is still a very deceptive thing that they did. By doing this, in my opinion, I may be wrong. By doing this, I don't know what happened in their system to say, let's do it. But in my opinion, by doing this, they would now look like an angel to say, look, if something really had something good, we would talk about it in a positive way. And if we didn't talk positive, that is because it was not positive. And they still will have to, and you may have read their response to Washington Post, I believe, where the Washington Post had asked them that why did you say that Joe Rogan had taken ivermectin and it's horse dewormer? And they said, well, the basic problem is about the vaccination and stuff. And they still did not say that we were wrong. They were wrong. When Rogan said that they lied, he's actually correct. When they say Joe Rogan took horse dewormer, Joe Rogan did not take horse dewormer. His doctor prescribed him a medicine that was for humans, and they prescribed him a human medicine, human grade medicine. He did not go to Amazon and buy paste and take that. So this was the lie. Then their continuous insistence that it is a horse dewormer. Maybe the experts they have around are coming from veterinary sciences, and so they can only give them the advice to say, hey, this medicine horse dewormer, this medicine horse antidepressant, and that is maybe how they get their information. But if there are human doctor experts who would be advising them, then they may get better advice. And I think that they were wrong in what they did. Correct. So Janet says that they always hold up dexamethasone as proof of being reasonable, and now they're gonna, CNN is gonna say, look, we talked positively about fluvoxamine as well. So, and Rima, that is correct. It's not just CNN. This is, you can actually see when this rhetoric got turned on, and all channels started talking in the same way. Who gave them those talking points? All of a sudden, all of them together, and then now it is slowly phasing out. That was weird for me. I am usually not conspiracy theory type person, and it was just weird that they did this. Ganesh says, seeing your paintings, I got interested and I started to do some art in Paint app. Do you use pen to draw or the mouse? The computer pen is better. So yes, I have. So of course, this is the pen here, and then I use iPad with the pencil. Skyfrog says, would you like to be a guest in Joe Rogan? Absolutely, I would love it. So Sasha says, don't blame you. All this has ruined CNN. CNN, I used to be a little bit more inclined towards listening things from CNN. I am just done. And the the reason I feel bad is if they intentionally, if there is a possibility of a mistake, and one can correct the mistake, but they just keep doubling down on it, and they're doing it in plain sight. They know they are pulling wool on people's eyes. And if that is what they're doing, how many more things they would be doing this about? CTR says, I would love to see you in Joe Rogan. Thank you very much. Hopefully. Gift says, have Joe Rogan on my show. That is an interesting one. I should actually reach out to him and say, hey, let's have a talk. Yeah, that will be interesting. Yes. Okay, I'm going to tweet at him. I don't know what happens. We'll see. Done. Will do. So Danilo says, since antibodies are made up of V, D, and J segments, does it mean that the very SARS-CoV-2 variant has its own specific variable part and the same D and J antibody segment present in our B cells? Yes. Very, very good question. And yes, it's always the variable unit that is different. The remaining part of the antibody is the same. And that is what is called somatic hypermutation, right? Banyan and Nomad says, my apology, the question, please ignore. What was the question? John says, can quercetin 250 milligram daily on a prophylactic basis? So without having this experience, From a mechanism point of view, it is possible that if there is a problem with the thyroid function, and then the TSH keeps telling the thyroid to make more, then TSH levels can be up. But I have no experience of what levels should do this. Janet says, brought to you by Pfizer. Yes. So there is a good question. Tech Ad SR says, will breakthrough infection after vaccination still build natural immunity? Yes, absolutely. Absolutely. Every exposure to the genetic material, I'm saying genetic material, to the antigen will cause affinity maturation, will cause increased number of cells to be formed, will cause more memory cells to be put in various places. So yes. Jack says American Academy of Pediatrics is also generously funded by Pfizer. They removed that wording and the Pfizer logo after they were called out on it. Generously supported. People tell me that I take money from these people, so nobody has ever reached out to me and say we would generously support you. Ganesh says Joe Rogan will have a great time with you. Yeah, it'll be fun. Okay, so let's do one more question. So Grace, so let's do two. Grace says, Dr. Min, is there anything that can help lungs replace scar tissues? So couple of things. Number one, physiotherapy is very important because it allows the lungs to learn to start expanding again. And then there are some drugs that in the early part tries to break the fibrous tissue and help. So if you're talking with your pulmonologist, that can help, but it is a difficult situation. Jordan Perry says, IVM low dose once or twice a week before travel, swollen along jawline and cheeks, pimple like one boil. Reaction to IVM, should I stop taking? So Jordan, same request. I can't give a personal advice. From generally a mechanism point of view, I have not seen any patient saying this, but I can't. I I don't know. So an important thing to do is to talk with the doctor. Swellings could be lymph nodes. Swellings could be other things as well. So just get the physical, uh, you know, uh, get yourself checked with the doctor. Okay, cool. So hmm, correct. All right. So there are some more discussions happening. Thank you very much. And please like, subscribe, and share. Long video. Many times it is difficult to subscribe and share, but maybe just like it. And secondly, if you would like to support this work, if you like this work, then there are links in the description. You can buy me a coffee or be a patron or use PayPal. So thank you very much. And I would see you tomorrow. Maybe tomorrow we should do Zoom. Okay. Bye bye.